I was just like,
yeah. Good morning.
Good morning, everybody. Welcome to the Medicare Cafe. This morning we're starting with the pre-chat. Before we get started, I don't know, we've introduced ourselves in a while. I think we think like we're a big enough deal.
People know who we are.
They know who we are. But for those of you who maybe like didn't get the memo, my name's Olivia Richardson.
And I'm Carrie Vogt.
Carrie, you came in here, said I had the perfect thing. It just happened. I want to talk about it this morning.
Just happened.
The pre-chat. I'm going to sporadically throw in a Boston accent. I've been doing that on accident anyway. So like,
there you go.
Just so you know,
okay.
Boston, if it happens,
keep me on my toes.
Just go with it.
I'll flow with it. So I've got a client who's on a med sup and a PDP. He emailed me and said, yesterday, he said, hey, just wanted to let you know we added some dental coverage to our plan. We went to the dentist and like nothing was covered by our med sup, which we knew. And so I asked him, what's the best dental plan that you recommend? And he said, United Healthcare ARP. So.
What? Well, I guess, yeah, go ahead.
So they Googled United Healthcare ARP. And he told me the name of the plan. They enrolled in the UHC Advantage and got $1,000 of dental. And I said, you did get some dental, but let me tell you what just happened. And so they were just like freaking out.
How did they have an enrollment period to do that?
That's what I said. I said, first of all, how did you even do this?
Yeah.
I said, don't stress, and they have like lots of
like health concerns?
Yes.
Oh, okay. So this is genuinely like a bad move for them.
It's a very bad move, and they travel all over.
So this is
they
their
travel
nightmare.
all over. They like live like 3 months of the year in Virginia.
Jeez.
And so yeah, I don't know. I don't know how they. I said don't panic. I was like I think this might not even go through because I don't know how you were able to enroll in it.
Yeah.
And so anyways, he was like, well, I'm gonna call today and cancel. And I was like, don't like think if you were to enroll in a plan, like in an Advantage plan, I was like, this is the one that I would enroll you in.
Yeah.
So like
fair.
worst case scenario, like it'll be okay.
But if it's their first time, then they could trial right back.
Yeah, and I said that. I was like, they could trial right back. And
God, but that's just like goes to show how uneducated. Because why would they know that? Why would they know? They asked for dental coverage from their dentist. Like you can follow that line of thought. Their dentist said, "Oh, a lot of my clients have this plan," so they went and got that plan. Like I can follow the logic.
I know.
I can absolutely.
And just what if? I'm just trying to think of like what if they didn't tell me.
Yeah, because you're really lucky that you got that by the way call.
Yeah.
Which shows that, like, again, the reason you got that call is because you train your clients that, like, if it has the word insurance in it, you call me. Yes. So, I guess that's great that they called you, but, like, gosh. And everybody, like, there was nothing that anybody did wrong. They just didn't do it right.
And so then I was like, did your dentist say UHC ARP dental? Or UHC Advantage? Like, what did they say? And he was like, just UHC ARP. And I guess I didn't realize there were multiple
why would
options.
they?
I was like, yeah.
Because there are. And what's going to be even more confusing is that UHC is launching in 2023 a dental plan for their supplements.
Yeah.
So let's just add to that confusion.
I forgot to ask you. So I went to one of the UHC rollouts a couple weeks ago. Maybe that was last week. Abs Lab, am I saying that right?
I don't know.
Abs Lab. The
Lab.
dental. I've got dental in my mind. The diabetes DME supplier. Is that sounding familiar at all?
No, it's not. But that means nothing. That means nothing.
It was mind blowing. So I guess UHC has I'll have to think of the name. I know it starts with an A. It's a DME provider, like pharmacy, that gets diabetic supplies covered like zero cost. Like, so I guess a lot of people will go to the pharmacy, get their prescriptions, and they think they'll get their like test strips and their meters and all that stuff.
Right.
But Part D doesn't cover that. So a lot of them just pay out of pocket for that. But this is they partnered with UHC, and it's a way to make sure it gets billed under your Part B.
Really?
And
I like
it's
that.
all zero cost.
I like her. I mean, again, like I hadn't heard of that. I do know like United Healthcare is very much. And again, if you have any questions, comments, concerns, such a promise, text us. I'm watching our text line right now. I do know United Healthcare put a ton of emphasis on user feel on user, like how usability, I think is what it is. It's like making sure that people actually do utilize the benefits because that's what everybody offers, these really cool things, but not everybody makes it easy to get.
Well, and that's what the other thing that was really cool is she was like, if you're meeting with somebody in October during open enrollment, these plans aren't active until January. She was like, we'll send them to them for free until the plan starts.
That's like, pretty cool. That's pretty phenomenal.
I know.
I'm on board with that. So, wonder if you guys have anything like that. Any, it's good to know, like, even, like, some of those local nuances. So, absolutely, 100%, go to your local rollouts. I went to the national rollout in Dallas and spent a couple days with UHC's Top Guns and got a lot of really cool things. But those little nuances like that, like, they didn't mention that at all where I was. So, like, go to your local market trainings and make sure that you, like, are talking to the reps there. I think she said that was a
national, like,
that's crazy
incentive that they have with UHC.
So, what are we talking about today? First and foremost, Golly, There's
that Boston accent.
I'm just randomly throwing out Boston accents here and there. Not good Boston accents, but Boston accents sound the same. We're doing on Medicare Cafe today the agent point of view.
More compliance.
Whoop, whoop. And the reason why I wanted to talk about this is because every webinar that we've done since like July of this year, I get a lot of, regardless of what the topic of the webinar is, every question I get is the compliance. So going into, we are down to 17 days? Ooh, that was a real shudder. That was real. Whoa. We're down to 17 or 18 days until October 1st, until these rules go into effect, until AEP happens. So I wanted to get an opportunity to kind of answer any questions and make sure we really talk about what is your day-to-day going to look like once AEP hits.
It's going to be busy.
Because
That's what
it
it's
does.
going to be like.
Well, it changes. Mm-hmm. Even, I don't care if you do Medicare Advantage or PDP at all, your day-to-day is going to look slightly different October 1. So these are why some of the reasons you're going to have significant changes in your day-to-day starting October 1st. Number one, the call recording. It is. And there's a lot of other like rules and regulations that went into effect with the new compliance that do go into effect October 1st. But the big one that everybody's talking about is call recording. Mm-hmm. I wish there was more talk about the disclaimers in the chain of enrollment.
I think disclaimers, if one of the disclaimers is what I'm most worried about. Yeah. I'm just worried I'm going to forget.
Well, you're worried about the disclaimers because you have your call recording figured out.
Yeah, that's no big deal to me now.
Yeah, you're like, move on, next thing. You have that figured out.
It's a disclaimer. I'm just worried I'm going to forget.
I understand. So when we get into the call recording, I want to do what your solution is versus the Medicare Center, because I think there's pros and cons to both. So I can't wait to kind of listen to like what your plans are come October 1st for your call recording. Because again, everybody's really focused on that, but there's a lot of other things, guys, that are going to affect what your day-to-day looks like. So let's just get the big one out of the way. And again, guys, reminder, if you have any questions, comments, concerns, threats, or promises, text us. Or you can put it in the chat over there on your YouTube, on the YouTube machine.
I forgot, what is it? Was it
BLAH.
Oh, yeah.
Because I'm 12. That's been my... Anyways, I won't go in. No, you're good. So let's start out first with call recording. How is that going to affect every day? So first and foremost, I get this question every single time. Do I have to record every single phone call? The answer is yes. For the love of everything that is good in AEP, please record every single phone call from your business. Obviously, do you have to record the phone call between you and your mother? No. If you're going to talk about last night's meal, you don't have to record that phone call. If you're going to enroll your mother into any type of plan or talk insurance with her, that call needs to be recorded. So it doesn't matter if it's just an appointment, doesn't matter if you see your clients only face-to-face, it doesn't matter. You have to record every single phone call because, for one, you don't know if that phone call is going to turn into discussion about MAPD or PDP, and two, you don't know if that client will eventually become an MAPD or PDP client. And you have to record everything in the chain of enrollment, which we'll talk about here in a little bit.
I panicked yesterday. Somebody called my cell phone, and I was like, I don't have the recording set up on my cell phone. I just was like, so I called him back on the recorded line, but still.
On the record. And so I want you to talk, I want to talk a little bit about Medicare Center. Actually, I'm going to switch it up because we're there anyways. So there's really two options. You can utilize the Medicare Center platform, which I'll talk about here in a little bit, or you can do what Carrie is doing. And so, Carrie, you've actually utilized, so just to give a little background, you now have Ring Central.
Yes.
And you have Ring Central turned on to where it will store your recordings indefinitely, because again, these have to be stored for at least 10 years.
Voicemails and calls.
Voicemails and calls. The problem that you had was that you had trained your clients to call your cell phone.
Yep, I have
which
a
is
work
not
line.
which is not your Ring Central, correct?
Correct.
So tell me about that transition and what that's looking, because you're just like, Psh, I'm over call recording. I'm on to the next thing. Tell me a little bit about like why you're so confident with that.
So with Ring Central, you have the option of you go into the settings and you can forward calls. So anytime someone calls, my biggest worry was, on my card is my work cell. That's what most of my clients have. And so
which is different from your Ring Central number.
Which is different from my Ring Central number. And I was like, gosh, I don't want to have to tell everybody I have a new number. How was I going to do that? And so there's a capability in Ring Central to call forward. So anytime someone calls my personal work line, I can forward it to Ring Central. So they're calling the same number, but it flows through to Ring Central, so everything's recorded.
So what would your plan be? Because I know a lot of agents, they don't have a separate number. So like if it was like you gave everybody your cell phone, your cell phone number, now you have to record those calls. What would you, because you don't want to auto forward everything, because again, you don't want your conversation with your mom about your dinner last night
to go to Ring Central.
So what would you do then?
If I didn't have a separate work line, if it's all personal, I think you do have to give out that Ring Central number.
I agree.
I mean, you just have to do it.
Yeah, I 100% agree.
And I'm still going to, I just did it this morning. I told the clients I was talking to, hey, you're also going to see a new number pop up for me. I'm going to have 2 numbers now just in case they do have my Ring Central number, which, you know what? It's okay if you have 2 numbers.
Yeah, it absolutely is. I mean, most organizations are going to have those 2 numbers. Yeah. And I think the same thing, my advice is going to be the same thing with the Medicare Center line. We'll get into that in a little bit.
I was going to say, we've got a couple texts, too.
So while you're reading those texts, I will say, if you do have your own solution, the biggest things you have to keep in mind is that those solutions had to be secure via HIPAA. So you had to make sure there's 2-way authentication. Don't use a free service. You have to make sure that you're storing them compliantly to where nobody can hack that information, which typically is going to come with some sort of fee. And make sure that those calls are recorded for at least 10 years. I know you didn't mention this, but I'm sure you will attest to this, that a lot of people think, well, how do I go back and find these calls? If I ever get audited, how do I know, okay, I need to go to, I enrolled this person on this day at this time? Because you know what I mean? How do I can't go and download and rename every single phone call. That would take forever.
Yep.
So making sure in your CRM that you have to have a CRM, take really, really, really good notes and make sure that your call recording is timestamped. So you say, okay, I talked to this person from this phone number on November 3rd. Okay, let me go to my Ring Central or wherever I store these calls and pull my calls from November 3rd to find that one.
And I think...
So just organization will be key there.
Absolutely. And I think at least on Ring Central you can search... There's a search function by number. I think so. Yes.
On Ring Central there is, but again, you have to know
still
what
be
number did
in
they
your
come
CRM.
from. Yeah,
yes.
it's to do it in your own system. Organization is going to be, I think, one of the most important things.
For everything.
Let's get to some questions. Yeah.
Brian said, remind us, we can
Morning,
mention
Brian.
AEP and ask for drug lists prior to October 1st.
That is correct. Correctamundo.
That's correct.
That is correct. You can do that. You just can't mention any 2023 benefits. You can't say, hey, your plan's going to look really, really different. Come January 1, I need your drug list. We need to set up an appointment. You can't do that because you're talking about 2023 benefits. You can say, hey, AEP is coming up. If you want me to, check your plan, or if you want to review your plans, this is the information I'll need ahead of time. Let's set an appointment.
Yep.
That is new as of 2018. You couldn't do that prior to then. Now you can talk about AEP prior to AEP.
Someone else said, if this is what I was referring to earlier, yes, it is. The ADS, Advanced Diabetes Supply. Yes, I don't know who you are, but that is it. That's it. ADS.
Cameron's there.
Yeah. Wasn't going to work.
You were really saying abs, and I'm like, that sounds like a really great workout plan, and I'm in. If United Healthcare will give me abs, done. Enroll me.
Advanced diabetes supply. Yes.
Thank you, Carrie.
Love it.
Michelle was saying I plan on creating a laminated card for
I
using
love
my
that.
disclaimer each time.
That's right up my alley.
Yeah, laminated.
I love it.
Nerd. But yes, I'm on board with that lamination, yes. Yeah, Jigsaw Planning, good morning, says, for November 2022 enrollment, do I have to record the call? So technically, no, because this update does not go into effect for 2023 plans. So you don't have to technically check or track the enrollment for anything prior to the 2023 plans. I do recommend just going ahead and doing it. Just be safe. Like we said, record everything, being safe, but on a technicality, if the enrollment is for any time in 2022, no, those rules will not apply there.
Because if you're enrolling someone in November, I mean, even depending upon the plan, they're only going to be on that for maybe 2 months.
Exactly. So you'll need to
talk about next year anyways, which, yes, then that would need to be recorded.
Yep. Michelle says for rural calls, like bad signals, areas with low internet, does Ring Central still work, and the cost? In my experience, again, I grew up in a town where my neighbors were sheep, and my Ring Central does work there.
I never ran into it not working.
It is, I mean, to be honest, it is a cloud-based system, so it is dependent on your access to cellular service or internet access. It is 100% ring-based. So if you are in an area where cellular service isn't an option, internet is not an option, then your Ring Central would not work.
I don't know if Med Center will do this, but my favorite thing about Ring Central is as soon as somebody calls, if they leave a voicemail, within 10 seconds, that voicemail is transcribed and it's an email to me.
Yes, Ring Central does that as well.
No, does Med Center do that?
No.
Okay.
Not yet.
Yeah, so that's my favorite thing about Ring Central is that, like, it just immediately sends, like, because if you're in the middle of something and can't listen to a voicemail, it goes to your phone.
How urgent is this? Let me read it. Yeah, no. Medicare Center doesn't do that yet. Okay. I'll just put the word yet on there. Yes. Question, can you go over the Medicare Center alternative? So, yeah, I will do that here in a second. What is the benefit for paying for Ring Central versus Medicare Center? So there are quite a bit of benefits of paying for Ring Central versus using the free version of Medicare Center. Reminder, guys, I am doing a full Medicare Center call recording training this Thursday. So if you want access to watch that, go to smsteam.net, click on the events tab. You can watch that whole thing. It's at 2 o'clock Central Standard Time on Thursday. Get registered for that. But Ring Central does have a ton.
Remind me to do that.
I'll remind you, yeah. Ring Central does have a ton of extra bells and whistles that you get because you're paid for service. So, number one, I think a big part of that has the texting capability. Medicare Center is not going to have texting capability. You cannot text from your Medicare Center number. Ring Central allows you a lot more control, so you'll be able to do more. Like, you can pick the phone number that you get. Medicare Center is not going to allow you to do that.
Ooh, can I have a question about texting?
Please, yeah.
So, on at least iPhones, you can, like, do the settings that records text forever. So would it still be compliant to have somebody just text you that's not under Ring Central or Med Center since it's technically recorded forever?
As long as you can have that on record for 10 years, it is compliant. As long as your communication is on record for 10 years, you're good. Yeah, that'd be fine. But again, with Ring Central, again, it just gives you a lot more options and a lot more control versus kind of being at the mercy of what's given to you at a free platform with Medicare Center. Yep. So for Medicare Center, again, I don't want to get into too much detail because we're already 14 minutes in. We got 2 more points to talk about. We're going to be on the call recording. Yes, Zongo. Oh, that's Clayton. Hi.
I was trying to get my comments.
I was like,
to work.
Zonko, what a name. That's Clayton Clemens. You guys might know him from the Medicare Cafe Facebook page. But yes, your comments are working, Zongo. But anyways, for the Medicare Center portion of it, essentially what will happen is that you will get a Medicare Center phone number assigned to you, right? And so it's based on whatever number you have in your Medicare Center profile. It'll base your area code off of that. So it'll give you an area code based on that. Well, the good news is that if you're a local agent selling locally, that's great. Somebody like me, who I'm a transplant to Central Missouri from Northeast Missouri, I have a Northeast Missouri phone number in there, so it makes me look like I am not local to my, So just understand that can't be changed. Again, I don't want to go into a full training on this right now. I will say that you do also have the option to do like call forwarding with Medicare Center. So you can basically, like, if you have an office line, you can set up that office line to call forward to Medicare Center, and it would ring on that. It will make it look like that your all incoming calls is coming from your office because it's just forwarding that from your office. So that makes it a little bit more difficult. Does store it for 10 years. It does automatically put those calls in the client's profiles, which is nice. So you don't have to sort it. You just go to that client's name.
That's
can see
really
all the outbound calls and any inbound calls there as well. So it does a lot. If you're going to be using the Medicare Center, the biggest thing is that you will have a new number. And so the usability of it is going to be, how do I train my clients to answer this number? Because the one thing you have to keep in mind, when a client calls that number or when a client accepts a call from that number, they're getting what they're calling and whispering, which is one of the disclaimers we'll talk about here in a second, which is this call is being recorded for, training and quality purposes. It does say that.
Okay.
So, and it's this weird electronic sounding voice that says that. So clients who are used to calling Carrie and Carrie answers the phone, they may be like, oh, shoot, I called the wrong number because this robot lady is telling me this call is being recorded. So what I recommend doing, because you will have people that will continue to call your cell phone. You will, I always recommend accepting that call and saying, let me call you back from my Medicare line.
Yep.
Let me call you back from my Medicare line. Or, hey, here's my Medicare number. Will you call my Medicare number? And getting that number in your client's phone.
Absolutely.
Because they're not going to recognize it. So making sure that client understands, I need to call this number, anything coming from this number, and naming it. Saying, this is my normal line. I actually have this separate line set up. And advertising about why the call recording is beneficial. Saying, I can even send you a copy of the recording. So if you have any questions, you can reference back to it.
Yeah. Some clients would love that.
Exactly.
Christy Deal asked, can we just record on our laptops?
Yeah. I mean, if you wanted to, the problem with recording it on your laptop is that if you ever want to take a call when you're not in front of your computer, it eliminates that option. So that's why it's going to be nice. Medicare Center is coming out with a phone app this week. They're coming out with a phone app.
So Med Center must obviously, you just have to download the app.
Yeah, download the app and it'll be able to make calls. And even if you have the app open or not, you'll still be able to receive all the phone calls that'll be stored there. But in order to make phone calls, you have to make them through the app.
Gotcha.
So. Terry asks, I have an 800 number. Does Medicare Center handle that? Answer is no. If you have an 800 number in your profile, it will not generate a number because it needs to go off of a local area code. So it's not a big deal. Easy fix. Go into your profile, update your phone number in there, log out, log back in. You'll be assigned a new Medicare number.
I think that was... is that all of them?
Yeah, Jigsaw was asking, 3 years later, if you drop Ring Central, what happens to the 10-year rule? You can download and store all those phone calls separately. So it'll still allow you to, take those phone calls off that system, and you'll still have access to that system. But I would recommend, if you do drop that service, to back up those calls. So again, guys, don't want to spend too much more time on this because it's 10:20. I still have 2 more points to get into, but if you have questions, if you have more questions on call recording, hold them till the end. If you have questions on Medicare Center call recording, hold them to the end. I promise we will get to them. Next, the next point that's really going to affect an agent's day-to-day are the disclaimers. Yeah. There are now 3 disclaimers. There's actually dozens of disclaimers in the Medicare world right now, but there's really 3 that agents need to worry about.
Yep.
There is the call recording disclaimer, the appointment disclaimer, and the marketing disclaimer. Yeah. The call recording.
All important.
All important. The call recording, if you're going to use Medicare Center, that one's handled. The whisper does the, this call is being recorded for quality and assurance purposes or quality and training purposes. I will tell you that not every state requires it. They're called single notified versus
Missouri's not one, right?
Yeah, Missouri does not require you to notify somebody that they're being recorded. Still do it.
Yeah.
I don't think it's a big deal.
No.
Let me ask you from your perspective. Do you think clients are going to be super opposed?
No, I don't.
I have so many people being like, my clients, there's no way they're going to accept it. I'm like, every single communication they have with any company is a recorded line.
I don't think it's going to be a big deal. Now, if you make it a big deal, they might, but I mean, I think if you just say this is another, do clients fuss about a scope of appointment? No.
It's just
part of the process.
I was just curious because, again, in my opinion, it's they're being recorded. Everything they do is being recorded elsewhere. So, if we make it a big deal, do you have, a spiel planned to explain the call recording yet?
I don't. I was actually working on it yesterday. I don't have one set yet.
Yeah.
I've got a few that are kind of in the works,
yeah,
but nothing that like feels in my groove yet.
Yeah, I gotta find something that's natural for
Yes.
you. For me, it's all about just explaining like why, and like you don't have to get into details because they don't care about that stuff. But just saying like, I'm recording these phone calls. That way, we have access to. If we ever forget a question you have or ever forget anything, I have access to it. Like always make it to where it benefits them.
Oh, absolutely.
But I don't even know. Like, do you feel like they even need to explain why? Because it's just kind of like
no.
Everybody
I would
does
say
it now.
definitely have like a rebuttal because some people are gonna ask.
Yeah.
But I don't feel like you have to just say it from the get go.
I think that's very fair.
I don't think so.
Sound advice.
That's my opinion.
Yeah, I like it. So again, that's
as soon as I get my first
I want to hear
hesitation,
about it. Yeah.
I'm going to tell you though.
Please, I'm really curious because again, like I might just be super naive since I don't have to work with consumers in the space that we're in right now. I would be really curious. I want to hear your experiences.
You posted. So the appointment disclaimer, I'm trying to keep track of which one's which. So the appointment is the one that's we do not represent all Medicare plans, correct?
Yes.
So if you haven't, I've already put that one in my signature.
Ooh.
My email signature because I'm corresponding with clients via email all the time. And so just a reminder to put that in your email.
I think like you're going above and beyond. And if I were an agent like today, and that was what I was doing, I would follow your lead and like put that in my signature. The important thing to realize is the appointment disclaimer is only necessary at the beginning of a sales appointment. So like a lot of people were saying like, okay, well, how do I say the call recording disclaimer, the whisper on Medicare Center, can we add the appointment disclaimer to that? And it's like, you really don't want to. Because again, you only need to say that at the beginning of a sales appointment. So any communication, like if your client's calling to ask questions about their current coverage, calling to set up an appointment, asking about, other things, you don't have to give that disclaimer. Only at the beginning of your sales appointment. And the full disclaimer is, we do not offer every plan in your area. Any information I provide is limited to what I do offer. Please contact 1-800-MEDICARE or Medicare.gov to get all of your options in your area. And so I know like that is something has to be said within the first 60 seconds of that appointment. And it's about a 15-second disclaimer. So for me, it seems like it's a super sales point against using agents. I mean, it is. I'm not going to sugarcoat that. So I always like to make sure agents are pairing that with, make sure you're reselling the value of using an agent. Of saying things like, now
absolutely.
And like explain, I have to say that we're talking about government sponsored plans. I have to, there's some things, some bells or some T's to cross off and I's to dot. But this is why you use me. I do the research ahead of time. I'm not going to put you with carriers that don't value their clients. I'm not going to put you with carriers who are fly by night. I choose who I want to represent based on how they treat my clients. So if you want to work with the carriers that have been vetted by me, we can do that.
Perfect. Said so perfectly.
Yeah.
I want to record that. I remember.
It is recorded.
I know. So I can practice that, though.
Yes. Michelle asked, email, verbal, Facebook, Google, anything else for sales disclaimer. So yeah, I want to get to that marketing disclaimer here in a second. And then Mary says, if I'm doing Microsoft Teams, can the disclaimer just be posted in the chat or does it need to be done verbally? So there's a little bit of like
interesting. That's a good question.
Yeah, misleading information. From my understanding, it needs to be said verbally, but that was specifically if it was done over the phone. I will ask our compliance officer, Mary.
I feel like Teams and Zoom are a lot of gray area.
If there is a chance for visual communication, I imagine that visual communication would be enough. You know what I mean? But I wouldn't put my name on like, yes, this is what I think.
Right.
That's just my opinion. I would also think that you're going to start seeing them on scope of appointments to acknowledge that, yes, this disclaimer was said to me. You know what I mean?
So the appointment disclaimer, if you have 2 phone calls, does it have to be said at each one? I don't remember.
So like
or just the first one?
Because you do I do my information at one, I do my enrollment at the other. I imagine it would have to be on
each
both.
One.
I would think. Again, like that's not like an official senior marketing specialist say, but like in my opinion, technically those are both appointments, so they would need to be said at the beginning of both.
Because I'm just trying to think like a lot of times, so I'm being connected by the advisor. So a lot of times our initial means of communication is email. And I've said that disclaimer in my email. So if we have our phone appointment or meet face-to-face, I just don't want to like oversay it.
Yeah, I can understand that. I would think like if the only time that they've seen that was in your email, I would at least say it once.
Right.
Either
but would I
face-to-face
have
or
to
phone.
say it? I don't know.
Here's the thing. I would think yes. And the reason why is because if you get audited or if there's a complaint to Medicare, they're trying to find out if it's founded or not, you don't want the information that they're wanting to be on the call that you didn't say it. Because you can say, well, I said it before, but that's before, it's not on this recording. You know what I mean? So, like, I would want it on any time I'm going to be talking, you know.
Gosh.
Anytime, I'll say this, anytime that you're advising on a plan, Medicare Advantage or PDP, it needs to be said. So, like, you're advising on the plan, the first communication, and by you enrolling them is continuing to advise them on that plan. So I would say that, that's just my opinion. That is my opinion. We can confirm with our compliance officer, though. He's just right over there. We'll just bust in. Say, hang up the phone, we have questions.
Hang up.
And then the last one being that marketing disclaimer, talking about, again, that one's not new. It's just making sure it's on everything. The marketing disclaimer is, you know, by responding to this advertisement, you may be contacted by a licensed sales professional. That's essentially what that disclaimer is. And understanding the differences between marketing and communications.
I feel like that one's not new.
It's not. No, that one's been around for forever. They're just cracking down on it due to the chain of enrollment, which we're talking about next. The CMS is now monitoring that chain of enrollment. So
I guess I didn't realize it was CMS.
Yeah, that's a CMS thing. That's a CMS rule, is chain of enrollment.
But they're the ones monitoring it? I thought it was the carriers.
So let me say...
Or no, the carriers implement the, like...
Yeah, it's kind of like saying, like, you know, the U.S. government make the laws, police officer enforce the laws.
Okay.
CMS makes the regulations, makes the rules, the carriers enforce the rules. So, CMS is going to be monitoring that chain of enrollment. So what chain of enrollment means is any possible communication that would potentially lead to a C or D sale. So that is the calls to set the appointments, the leads that they took to get in, your marketing materials, your banners, anything, any communication that could possibly lead to a C or D sale is considered part of that chain of enrollment. And how is that affecting your day-to-day is, number one, I think just goes back to the need of a really good CRM, because you are going to have to store for 10 years the communication that went to that client. So, like, if your client says, like, oh, hey, you know, I saw your Facebook page, and so that's why I came in. Then you need to have on record what your Facebook page looked like. Or they say, oh, hey, like, I saw your newspaper ad and I came in. You need to have in the chain of enrollment what your newspaper ad looked like, and making sure that has all the proper disclaimers on there.
My seminars, hey, I heard you speak at a seminar.
You need to have on record the presentation you gave. You know what I mean? So just making sure you have a really good CRM, and you might make sure, you should have been doing this anyways, but asking the question, I want to know if you do this. Hey, how did you hear about me? Of course you know, because most of yours are like your people.
I love asking that question. I'm always intrigued.
You know, I want more agents to do that, asking your clients, hey, how did you hear about me?
Always.
So you figure out what of your marketing is working.
Yeah. Oh, that's one of the first questions I ask. I missed a few questions on the call recording that were on the text line. Is there any problem with just telling the clients that call recording is required by CMS?
No, I always like to put it on the government.
Yeah, for sure.
I always say these are government-sponsored plans, and so they just want to make sure that you, the client, are protected, me, the agent, is protected, so CMS requires these to be recorded. That's fine.
Where can I find each of these disclaimers?
Yeah, so we actually have some frequently asked questions stuff on our blog, smsteam.net. Go to our news section. There's a bunch of information about the disclaimers there. We've also done some videos on them, too. So you can find them on our blog, smsteam.net.
Something that I feel like I've also said that kind of lightens the mood and breaks the ice is if you're saying, you know, we've had a little bit more complaints because of our favorite, you know, those Joe Namath ads, and they're just like, oh, blah, 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 blah. And like everybody knows those.
Yeah.
And I feel like that gets a laugh, and just be like, yeah, those have caused a few more complaints, and so we just have to crack down on some of the compliance stuff.
I love that. And being like, and I also, I mean, like, I wouldn't be, maybe I'm petty, who knows? But I wouldn't mind saying, like, if you're working with an agent that's not requesting this of you, they're not being compliant.
Yeah.
You know what I mean? Like, there's, they might, like, it's like, oh, they didn't need this from me. That's the first thing.
Yeah.
Well, they're not saying I need this. It's like, well, I will tell you, if you're working with an agent that's not doing this, they're not taking it seriously. Yeah. They're not, you know, what else are they not keeping up to date with?
Yeah.
So it's really easy to plant that doubt. Sadie asked a really great question. Do you think we can expect a rise in secret shoppers again? My 2 cents on this is, like, a short answer, I do. I do think you're going to see. If I had a crystal ball, if we were just thinking, like, what does Olivia think is going to happen? If only. I'm going to use this crystal microphone. If I had a crystal microphone that told me the future, what I think is going to happen, this AEP is going to be strict. I think there's going to be a lot of enforcing this AEP. The carriers are on our side. The carriers are like, this is ridiculous. This is stupid. They're trying to fight it. But they're being held to the fire by CMS. And there's no way a carrier is going to lay their neck on the line for an agent right now. You know what I mean?
Right.
So I do think that this year is going to be really strict. There's going to be audits. There's going to be random questions. And everybody's going to go towards that call recording. I think next AEP, I still think that you're going to see a need for call recording. I still think that you're going to see people asking for this still being a conversation. I don't know in 3 years that we're going to be talking about this anymore. I think the rules are really going to slack because I think by then CMS will have some hard data about the difference between call agents and field agents.
Gosh, I hope so.
I also know that right now, so many call centers that were infamous for making these mistakes have pulled out of the market because they lost their butts on people, on what's it called, immediate exits, or they lost a lot of money. So you don't have the amount of call centers doing this that you did last
How awesome
AEP.
is that for us, guys?
So I think, stick
awesome.
with it for a couple years, guys. I really do think CMS will loosen the reins within the next 3 years. If we can get through this, unless we just continue to see just chaos ensue, which let's not do that. But I really do think the reins will be loose.
Brian said Joe Namath can kiss my hairy derriere.
That's more about Brian than I wanted to know. But it's hairy derriere.
I blame Joe Namath for a lot of woes. Yes.
Yeah.
Yep. What's the other guy? JJ.
There's Joe Namath. Yeah, JJ Walker. There's a couple other ones, but we talked about last week the new rules that the celebrity endorsements need to calm down. CMS cracked down on the celebrity endorsements. So it should be something different. Yeah. But again, guys, when it comes to that chain of enrollment, make sure that you are super organized. Keep solid CRM notes. Make sure that you have the storage capability to do that. And lastly, check your resources. Check your lead sources. It used to be that, you could use a Facebook lead marketing. We always tell people, don't make your own Facebook leads, go buy them. And now Facebook lead companies are like, we're not going to show you the advertising. We're not going to give you that information. That's not compliant. So making sure that you're asking more questions to your lead vendors to make sure that they are CMS approved and that they are allowing you to see the content. If they're not compliant.
Yeah.
We do have a solution, though. Thanks to Mom and Dad and Integrity, there is a new platform called Lead Center. Go to integrityleadcenter.com, and you do have access to, it's basically if Amazon sold leads. It's really cool.
Oh,
and so
that's
you
cool.
can, purchase compliant internet leads, Facebook leads, telemarketed leads, newspaper leads, mail order leads, the whole 9 yards. You can buy them compliantly from Medicare.
Newspaper leads, that sounds pretty ancient.
It is, but they have them. It works. All right, guys. So that is what we have. What changes? How is your how does your day change day to day due to these compliance updates? Survive it. I honestly think, guys, just bear down. So many agents are leaving right now.
Yeah. That's awesome for us.
So many agents
are
leaving.
Awesome.
There's so much opportunity.
Selfishly, that sounds terrible to say.
Out.
That's
Carrie
awesome,
says,
but
leave. Yep. More for me. It's true.
Less cleanup we have to do from those agents that don't want to be compliant.
I love this side of you.
I mean, seriously.
Can I just be honest? I love this right now. I love me a sassy Carrie. But yeah, so there's so much opportunity. Stick it out, guys. Do what's right. Don't ignore these rules. Do not say screw it. There was a pretty popular video that came out that has since been taken off.
Oh, it has?
Mm-hmm. It has been removed.
She must have heard you talking.
Wasn't
he or
me.
she. I don't even know who it was.
Who is this person? Anyways, but that video has been removed. Carriers found it, said you can't say that.
Okay.
So please don't be somebody that's I'm ignoring it. What's the worst that can happen? Because I don't want to find out. I'm not willing to bet your license and your contracts on figuring out what's the worst that could happen.
No.
So please, please, please don't do that. So On that note, any questions, comments, concerns, threats, or promises, any more discussions you guys have? Again, everybody's focused on the call centers because that's like an immediate, like, this needs to change. There's those other two compliance updates you really need to pay attention to, the disclaimers and monitoring that chain of enrollment.
Peace out, Brian.
Peace out, Brian. Any other? But yeah, I don't know. So how do you feel?
Oh, that was directed at the agents, not us.
Mm-hmm.
Got it.
That was suspicious, Brian. Very suspicious. How confident are you?
I'm feeling good. So I always like October 1st through the 15th. That's when I meet with like my current clients. Mm-hmm. And I think that'll be the perfect time to get some of this stuff out of the way on like your clients that you're comfortable with.
Right.
And then by the time, I start meeting with like new clients that, you really need to impress, it'll just be easier.
I love
so
it. God.
I think it'll be fine.
Another question I have for you. How, like, based on, again, like we see for the past several years, there's a lot of stability in the market. Mm-hmm. We have heard from several carriers that are like, they're really upping their game. Like, everybody's really investing in those benefits. I know a lot of your clients are Med-Sup based. Mm-hmm. But even like on the PDP side and the MA clients that you do have, or the people who are Med-Sup going to MA, how much change in like your book of business do you think you're going to see this year?
Gosh, I don't know, because I've been going to a few rollouts, and of course, each one is like, we're the best. And I'm torn. Like, I was thinking one was going to be the best, and then I went to the next rollout, and I was like,
ooh, these are nice.
What? Like, but this might be the best.
Yeah.
So I really don't know. I think it's definitely going to be a slower. It's not going to be like a huge, lots of change year. Mm-hmm. But I still think I'm going to do more changing than what I'm expecting.
Oh, that's fair. I think super fair. Yeah. Corey asked, can we record the call ourselves? Yes, Corey, you can absolutely record the call yourselves. The biggest thing is just to make sure that it's able to be found.
To storing it, yeah.
The storage, whenever you're doing it yourself, storage becomes an issue. And storing it compliantly to make sure that you can't get hacked and people can look up that private health information. So you can't record the call yourself, but again, storage and security would be my concern there. If you have those answered, then by all means. Plus just ease of use, ease of recording. Stacy, she says, UHG is throwing down big time. Listen, I see all the plans and I hear from them all. It's going to be hard to beat UHG. I will say the biggest difference that I'm noticing from going forward is a lot of those regional plans that were like, because I don't dig regional plans all the time. I'm going to talk under my breath. I don't dig them. Mm-hmm. They made some significant updates, so I think they're coming have a comeback, but I don't think it's sustainable. Yep, so agreed. That would be like the biggest thing that I'm seeing right now. It's like why the Humanas, the Anthems, the UHCs, like those are like, I would be really hard pressed to take my business that I have there and move them to a regional plan.
I always get excited for AEP to see like how many of my Med-Sup clients want to switch. Because I feel like last year, the Part B jump made a significant amount of them weigh that option.
Yeah.
And so I'm just curious to see what will happen this year.
And I think, too, like, a lot of people tried out the MA option. Some of them liked it. Some of it didn't. The ones who liked it probably talked about it to their friends. So there might be a lot more people coming and being like, my neighbor has this and she loves it. I think there'll be more opinions on it, I guess I should say. A lot more opinions on it.
Those regionals offer the most attractive Part B givebacks, but not the best stability.
Stacey, that's 100% correct. They're really shiny, but that's my point. Is like they're just not stable. They don't have the backing of the names, of the lives, of everything to maintain those really pretty options. And Part B givebacks tend to be where people invest the most money because it gets the most attention. Yeah. But like I said, it's just often not sustainable.
Right.
So. We have gone to 10:40, guys. Again, we'll let y'all go. Let's just check the text line one more time. Looks like we've got nothing. Thank you guys so much for playing along with us. Any other questions, obviously, you can always continue to text that line. I'll be able to answer that. That is my line. You can answer that. Or, again, reach out to us, 1-800-689-2800, or email me, olivia.richardson@smsteam.net. I'll let Carrie know what your questions are.
I'll let what?
Carrie know what your questions are?
You'll let me know them.
Yeah. Just, let you know
Let me know
what your adoring fans want. So until next time, guys, have fun.
Make money.
And give impeccable
Lord help
service.
Me.